Senator Bob Menendez. Thank you for joining us.
Good morning, everyone. Thank you very much. I'm really pleased and honored to be joined by my colleagues from the House, Congressman Diaz-Balart, the senior member of the Rules Committee, who has been at the forefront of these issues since I served with him in the House, and I am glad to see that he is adding his voice and his caucus to this effort. And of course, my dear friend Javier Becerra, who is the vice chair of the Democratic caucus in the House and in a leadership position as well, incredibly important position on the Ways and Means Committee. And of course, our national advocates that are represented here today joining together. Now, it is encouraging to see Congress taking up legislation to extend health care coverage for children, because they are the most vulnerable in our society. We say they are the most important part of our society. We say they are our future. They're also the most vulnerable element of our society. And last year, Congress overwhelmingly passed an expansion with support from both sides of the aisle. But the last time this legislation came up, hundreds of thousands of children were left out. Children who are legal permanent residents of the United States, who follow our laws every step of the way, whose parents work hard and pay taxes. These children are currently barred from Medicaid or the Children's Health Insurance Program for 5 years. To a young child, 5 years is a lifetime. Here's what it means to bar legal permanent resident children and pregnant mothers from affordable public health for that long. As it stands, a girl with asthma who has to go through 5 years of attacks before she can get an inhaler. A boy whose vision gets so blurry he can't see the chalkboard in 4th grade has to wait till he is in high school before getting glasses. A pregnant woman who urgently needs prenatal care can't get it until her child will be ready for kindergarten. I haven't met anyone who is in outrage when they hear that kids with cancer and have no other form of coverage might have to wait 5 years to get chemotherapy. Most people can't believe that's the law, but it is, and it shouldn't be. Kids shouldn't have to wait a single day to get the care they need to save and improve their lives. Good health care is essential for them to be able to realize their God-given potential. And that's what we are here and talking all about. We all have a compelling interest in covering these children when it comes to public health. Making sure that they can get regular checkups and other preventative care means taxpayers don't have to pay for emergency room visits down the line. You know, if you're a legal immigrant child, permanent resident of the United States, and you don't have health care coverage through your family because they probably work at a job that doesn't include health care coverage, don't make enough money to be able to afford health care coverage, and ultimately get sick, guess what? You go to an emergency room. And you'll be taken care of in an emergency room. Far more expensive, far more consequential to that child's life. Consequential, those children are going to school, and while they're in school, if they're ill, do they not have the potential to contaminate other children, you know, from a simple cold to something more severe? So the reality is there is a public health context here as well. So when we take up children's health legislation in the Senate, we must, and I believe we will, include the Legal Immigrant Children's Health Improvement Act so we can eliminate the arbitrary waiting period for children and expectant mothers. If we pass it into law, it will be a major step towards making sure that no child goes to bed at night without health care in the greatest nation on the face of the earth. Now, let me just say that I had hoped that the Senate would have approved the committee nominations because I'd be in the Senate Finance Committee to make this argument. And that hasn't happened yet. So I may not be there when the markup comes along. But I do believe that what will happen is, if it's not in the chairman's mark, it is my hope and expectation that there will be an amendment offered and that that amendment will pass. And there are reasons for that, but I won't get into it here. And then, of course, be part of the bill, bring it to the floor, and move it to the process. I am also heartened that senators should know that President-elect Obama has said, I will not sign a children's health insurance program that does not include legal immigrant children. And so I think that is a very strong message from the President-elect. So I have faith and confidence, even though we're going through a little bit of a struggle here, that we will end up in the right place. Finalmente, quiero darle las gracias a todas nuestras organizaciones nacionales que son abogados para nuestros intereses aquí como una comunidad en el Congreso, a mis colegas, el congresista Díaz Balart y a Javier Becerra, que se unen en este esfuerzo con nosotros en el Senado. No hay ningún niño en este país que es residente permanente legal que no debe tener acceso al seguro de salud que el gobierno federal le ofrece a niños que cualifican. Si tenemos la capacidad de pagar impuestos como familias, contribuir a esta nación, servir a las Fuerzas Armadas de la nación, también tenemos el derecho de que nuestros hijos tengan un seguro de salud. Es en el interés nacional, en el interés de salud de todas nuestras comunidades. Un niño que no tiene un seguro de salud actualmente, si está enfermo en una aula, tiene la capacidad de enfermar a otros. Un niño que actualmente no tiene un seguro de salud y tiene que esperar a un salón de emergencia para recibir su acceso a salud es más costoso para nuestra sociedad y para nuestras familias y para la salud de ese niño. Y si vemos la capacidad que se puede desarrollar en cada niño que tiene un salud ejemplar, pues sabemos que van a contribuir mucho más a la nación. Estoy convencido que vamos a tener éxito en este esfuerzo, que vamos a cambiar la ley que es injusta y que le vamos a dar a niños que son residentes permanentes legales de los Estados Unidos la oportunidad de participar con todos esos otros niños que tienen un seguro de salud. No hay ningún niño en este país que actualmente se debe acostar cada noche y tener la inquietud que no se puede enfermar porque no tiene un seguro de salud. Y eso es lo que estamos tratando y lo que vamos a lograr en este Congreso. Muchísimas gracias.
Thank you, Senator Menendez. We appreciate your championing this issue and your leadership.